Hi, my name is Kelly Schneider. I am the Restore Program Coordinator, and you are tuning in to your post-total shoulder surgery class. So this means that you have been given the clear to return home or to the next level of rehab following a total shoulder surgery. So the first thing we'd like to talk about in this discharge video is just helpful tips on reducing pain. And so ice is one of the most important ways and easiest ways to help reduce pain. So you can ice as often as you would like to relieve pain. We're going to be sending you home with a nice sleeve with some gel inserts in it, as well as 2 extra gel inserts. Those inserts freeze in 2 hours and thaw in 2 hours, so you're able to rotate that ice pretty easily. You're going to hear all kinds of stories about ice. The biggest thing I can tell you is that you can ice as often as you would like, for as long as you would like, if it is helping with your pain and your swelling, as long as you're keeping a protective layer between your skin and that ice pack. So your shirt, a towel, a pillowcase, something like that, just in between that gel ice pack sleeve and your skin. You're going to continue to wear your sling for at least the first 3 to 6 weeks. That's all dependent upon your surgeon and which type of shoulder replacement that you had. We ask that you do not drive while you're on narcotic pain medication. And really the best rule of thumb for that is just don't drive until you're cleared by your surgeon. He's the one that knows when it is best for you to return, as well as you're going to be wearing that sling. So you're going to have limited shoulder movement to begin with. So there are 2 different types of shoulder replacement. So the shoulder precautions are pretty much the same. You can see on this slide, there is an anatomical total shoulder. And so that one, I actually have a picture there just to kind of remind you of what that looks like. And so that is just putting a new shoulder in the exact same way your old shoulder came out. You're going to avoid reaching behind your head. You'll need to wear your sling for 6 weeks anytime you are up and out of bed or moving around. No lifting anything greater than 1 pound with that surgical arm. Avoid any kind of active shoulder motion. So don't use that arm really for anything for the first 6 weeks. And then no driving, it says on here, for at least 3 weeks. And that also really needs to be verified by the surgeon. So there's also the option of a reverse total shoulder, and you'll know which one you had. You'll have been told. And so if you had a reverse, that's where we take your shoulder and basically turn it upside down. And so you can see that pictured there. Again, still no reaching behind your head. You'll only need the sling for about 3 to 4 weeks. No lifting anything greater than 1 pound. Avoid any kind of active use of that shoulder until you're instructed differently. And again, no driving until cleared by the surgeon, which is about 2 to 3 weeks. So for pain control, your surgeon is going to send you home with a prescription for a narcotic pain medication. Most of our patients go home on oxycodone 5, and we use that oxycodone because it does not contain Tylenol. This way you're able to take Tylenol over the counter and then take the oxycodone at any time without having to worry about overdosing yourself on Tylenol. Other options that do not contain Tylenol will be like an Ultram or a Tramadol. If those are not working for you, then sometimes patients will go home on a hydrocodone, which is Norco, or Tylenol number 3 or number 4, but those do contain Tylenol. So if that's the case, then you do need to remember when you take those, you have to count the Tylenol milligrams for that so that you don't take too much Tylenol. You're only allowed 4,000 milligrams of Tylenol in a 24-hour period. But for the most part, we'll send you home on the oxycodone, 5 milligrams, and those can be taken as needed for pain every 4 to 6 hours. Some common side effects due to narcotic pain medication are constipation, nausea, drowsiness, confusion, dry mouth, itching, and dizziness. So the biggest of those that we are really concerned about is for sure the constipation. And so what you don't want to happen is you go for several days without having a bowel movement. So we ask that while you're taking narcotic pain medication that you please be taking a stool softener. If you have not had a bowel movement in a couple of days, then please take a laxative. You do not want to end up in the hospital again with a small bowel obstruction. So looking into your pain control options on this chart just a little bit better. So Tylenol and an NSAID are your over-the-counter, and that's how we treat your pain primarily. That's our first line of defense for pain control. We do that so that you're not having to worry about narcotic pain medication as much. And so you'll alternate the Tylenol and the Motrin, or Advil or Aleve. You'll alternate those every 4 to 6 hours. So Tylenol, you can take whatever you have at home. It comes in 3 strengths, a 325, a 500, or a 650. You can, whatever you have, just take it as directed on the bottle. Again, remember, you can't exceed that 4,000 milligrams of Tylenol in a 24-hour period. And then with the NSAID, that would be Advil, Motrin, ibuprofen, Aleve. There's some prescription NSAIDs that you may have at home, Celebrex, meloxicam, something like that. Those you can take alternating with the Tylenol. So for instance, you would take Tylenol at 8 a.m., take Motrin at noon, take Tylenol at 4 p.m., take Motrin at 8 p.m. And so you can see how you're alternating and you're having something in your system every 4 hours. The biggest thing with the NSAID is if we have you on an aspirin protocol for your blood thinner, you cannot take your NSAID and your aspirin at the same time. Those have to be taken separately. So we recommend that you always take your aspirin in the morning, start off with Tylenol, take Tylenol and aspirin at the same time, and then 4 hours later, you're safe to take that NSAID. And then again, your opioid or your narcotic pain medication, probably oxycodone, that can be taken every 4 to 6 hours as directed on the bottle, 1 to 2 tabs as needed. Highly recommended to take that with food. I've included in your packet a medication charting sheet. That is to help you keep track. When life gets crazy, when things return to normal, we tend to forget, oh gosh, did I take that aspirin? I don't remember when I took my last Tylenol. So this is to help you track that. You're going to be taking aspirin 325. That is every day, once a day for 30 days. That's what we use for your blood thinner. And then there's columns for the Tylenol, whatever NSAID, and then your pain pill. So you can keep track of how much you took, when you took it, and then that way you're not confused. So again, blood thinner, most of our patients in our Restore program go home on 325 aspirin once a day for 30 days. We ask that you take that with food. Best is to take it in the morning with breakfast. If you are a patient who takes a prescription blood thinner prior to surgery, you are probably going to go home on a Lovenox injection, and then you'll be resumed back onto your prescription blood thinner after about 3 days. And that will be very detailed for you in your instructions from your nurse as well as from your surgeon. So just some things to be aware of with taking and having blood thinners is if you have nosebleeds, bleeding from the gums, blood in the stool, or blood in the urine, that means your blood is too thin. You need to go ahead and contact your surgeon, let them know that that is occurring. We're going to have to make some changes with that blood thinner, but just something I want you to really be aware of. Now, incision care. So you have your incision currently covered with an Aquacel dressing. That Aquacel dressing is a waterproof dressing, and it is good for 7 days. On day 7, we need to go ahead and get that dressing changed, and that's 7 days from your surgery day. So if your surgery was Monday, then next Monday you're going to get that dressing changed. So most of the time, if a patient has home health, the home health nurse will come in and change that dressing. If you've gone straight to outpatient, then sometimes the outpatient therapist can do that. If not, we need to be sure to educate your coach or caregiver on how to change that dressing before you leave the hospital. So if this is you and you're going home and you're not going to have any caregivers coming in, it's just whoever lives with you or is taking care of you, then please get the nurse to educate that person on how to change that dressing. So they're gonna wash their hands before they remove your current dressing. They're gonna pull the current Aquacel dressing off with a taffy-like pull. And so that just means just grab from the edges and kind of stretch that dressing, and it will start to loosen all the way around. They're then going to spray the wound cleanser over the incision and kind of wipe it clean with some clean gauze. There is also a jumpstart dressing underneath that Aquacel dressing. It's a thin little, kind of looks like gauze. You'll have one in your Discharge bag as well. You'll have a jumpstart and an Aquacel. That new jumpstart dressing, they're going to spray with that Safe Cleanse spray and place it on to the incision. Then they'll place the new Aquacel dressing over the jumpstart dressing and just make sure that everything is covered and it's well sealed. While they're pulling off the old dressing, go ahead and place that Aquacel dressing underneath your thigh or behind your back so that Aquacel dressing starts to warm up to body temperature. If you do that, it starts to activate the adhesive and it makes that dressing stick a whole lot better to get that waterproof seal. So once you've done this dressing change at day 7, you really don't need to change the dressing again until you have your follow-up with your surgeon on day 14. The only time it would really need to be changed is if you're having a lot of drainage or if for some reason that dressing is not staying down. And so there is a picture in your folder of from the Aquacel rep talking about what that dressing looks like and when it would need to be changed again. Again, you can shower at any point with this dressing on. We just ask that you don't immerse your shoulder in water. Staples are going to be removed in 14 days, and that's usually done at the surgeon's office. At 2 weeks, your incision is considered fully healed. And so you can actually start some scar massage on that incision. And what that's going to do is it's going to break up the scar tissue underneath the skin. You'll go side to side and up and down along that incision and really work on just breaking that up and making that nice and loose so that you can continue to gain your range of motion. Not a comfortable massage by any means, but definitely worth it for range of motion, especially in those shoulders. You can use lotion to make it a little bit more comfortable. And then the big thing we ask is please don't allow pets to sleep in bed with you until your incision is considered fully healed. So they want to help and heal you and make you better, and they lick and they can cause a very nasty infection. So please keep those pets out of beds for now. Signs and symptoms to watch for. So if you notice any of the following, you can go ahead, if you have home health care, you can give that home health care nurse a call. If you're not receiving home health, then go ahead and call the surgeon's office. So if your dressing isn't staying in place, if there's increased drainage, redness, pain, odor, or heat, you need to let somebody know this is a sign of a possible infection. And then if you yourself spikes a fever of 100.5 or greater, you need to let someone know. We need to go ahead and check you. So blood clot signs and symptoms. So this, you want to go ahead and call the surgeon's office. If you notice increased swelling, in your legs, in your arms, you need to definitely be sure to check that. Pain or tenderness when you move your arm, or when even it can be in your leg when you get up and walk. Warm skin on your arm or on your leg. Red or discolored skin. Veins that are swollen, red, or hard or tender to the touch. So blood clots can develop anywhere, and so we just want you to be very aware of what those signs are. So if you have anything that you don't feel comfortable with, or it does not look like normal, if your arm is swollen a lot more than it used to be, and you haven't really exercised or done anything, it's been in the sling, if it's really, really tender to the touch, it's always better to be safe than sorry. Just call the surgeon's office. What's usually going to happen is you'll be sent to the hospital to have an ultrasound done, just to check the blood flow and make sure that everything is clear. If you notice shortness of breath or chest pain, that is a call to 911. That is an emergency. That means you have had a blood clot. It has broken loose and it is now in your lungs, and it can be life-threatening. So please call 911. That's a pulmonary embolus. So you're going to set off metal detectors now with this new joint in your arm. You're going to not go to the dentist for the next 3 months. So if you have a regular dentist checkup in the next 3 months, I need you to go ahead and reschedule that. No dental visits for 3 months post total joint replacement. You also want to let your dentist know that you've had your joint replaced. So you may need to take an antibiotic before any dental procedures if they are going to be going into the gums. So just for general dentistry, cleaning and things like that, the American Dental Association is saying that that's not necessary to take an antibiotic just for general dental upkeep. But for surgeries, root canals, tooth extractions where they're going to be into the gum line, then the recommendation is to go ahead and take an antibiotic prior to that procedure. That antibiotic does need to be obtained from your orthopedic surgeon. So this needs to be planned well in advance so that you can get all of that taken care of. So just keep that open line of communication between you and your dentist. All right, so that concludes your discharge instructions, and on the screen is my number. Again, I'm Kelly Schneider. I am the Restore Program Coordinator. I can be reached at 830-990-6134. If I'm not in my office and you have something else or a nursing question, the second number on there is actually to our nursing unit, and so that is 830-997-1299. Again, please feel free to reach out to any of us at any time. We are always available to you. We wish you the best in your recovery. Hope all goes well, and thank you for choosing Restore.